Arthrocare Spine presents nucleoplasty on the lumbar spine. The procedure is performed by Dr. V.J. Singh in Niagara, Wisconsin, and Iron Mountain, Michigan. Agonizing and sometimes debilitating back pain can be experienced by people with contained herniated discs, commonly referred to as a thrown-out back or pinched nerve. This injury can be accompanied by intense pain in and around the affected disc, as well as in the surrounding areas of the lower back and in the legs. Nucleoplasty disc decompression is the newest FDA-cleared method for treating contained herniated discs.
The nucleoplasty procedure is least invasive of all these procedures. The advantage of this technique is that you're achieving disc decompression with minimal tissue destruction and minimal heat generation. Disc is a living structure, and you want to maintain most of the integrity of disc as much as you can and take out only the amount sufficient to take care of the problem. Initially, patient is placed in prone position, then we tilt the patient, place a roll blanket, get an oblique view of the spine. Of course, we drape the patient and keep everything sterile and aseptic. Use a metal marker to locate the site where the cannula will be entering the skin. The location is typically just lateral to the cell heart. You can see on the screen of the image intensifier of the articular process of the vertebral body below the disc level you intend to enter. We are going to infiltrate the skin with a small skin wheel, and you just need a very small amount. This is a Crawford needle, and I'm going to give it a bend here. It helps to direct the wand in the most posterior portion of the disc. Now then I'm going to take a picture just to see what our location is. And I want to direct the wand right at the spot. I want to locate the spot where I want to enter again. Now we have to redirect the needle frequently to make sure that it doesn't go too far medial. Now this time it's going more medial, so I'm going to redirect it laterally, just lateral to the supraarticular process. I want to make contact with the lateral aspect of supraarticular process. On this sawbone model, we can see the correct approach of entering the disc. We advance the needle to touch this surface here, right here. The bevel actually is facing medially. If we turn the bevel laterally, it will easily slip off this articular process. So if you stay close to this articular process and if you slide it slowly, you can enter the disc. Now if you're having problem and patient complains of electric shock type of sensation going down the leg, then you turn the bevel medially and you'll be away from the nerve root. Then you can advance this down, and as soon as you touch the annulus, you can feel that typical feeling of the needle tip touching something rubbery, bouncing back. If this was nerve root, patient will tell you right away. At this point, you can safely advance the needle further and enter the disc space. The needle we use for this procedure is a Crawford type of needle. This needle has a very special bevel. It's not very sharp. If you look at the bevel here, you can see the angle, the way the bevel is slanted. It's less of a slant than the regular needle. If it ever comes in contact with the nerve, there's a less likely that it will penetrate the tissue of the nerve and just brush and slide off the nerve. We are looking for something which will help us prevent any kind of injury to the nerve, because as you see, when you're approaching the disc, nerve is sitting right here, and quite often you can hit the nerve. Precautions you can take to avoid hitting the nerve. One of them is that stay close to the supraarticular process. As long as you hug the supraarticular process, you will miss that nerve. We ask the patient to tell us if he feels any kind of sensation in his leg on the left side. And by moving this, if you don't feel any sensation, if the patient does not report any sensation, then you know you're in good shape. So now we have made the patient more from oblique position. Now he's completely prone. Now this is the AP picture, and what I'm looking at is what is the location of the tip of the needle. I may have to direct it medially, laterally, inferiorly. So we will take the two-dimensional picture. Now let's take the lateral picture of that. Idea is to enter the disc at the equator. You stay away from the end plate. Where we see that we are at the posterior edge of the disc space, actually quite a bit out. But we want to make sure that you don't want to be too far medial, because then you'll end up in the spinal canal. What I'm going to do, I'm going to direct this needle slightly inferiorly. Now here I'm touching the bone. That means I'm touching the supraarticular process facet. So I have to redirect the needle laterally. And what I want to do is to direct this inferiorly so that we enter the disk space at the equator. We enter the disk space right at the center. Now I'll advance a little more, and I can feel it when I'm going through the disk. You can really tell when you enter through the disk. Now that's the ideal entrance for the disk, right in the center. This patient has a very good disk height for this kind of procedure. Now we're going to do the both AP and lateral. You can see that this is spinous process, and this is the medial border of the pedicle here, and this is the lamina, medial border of the lamina. We want to position the tip of the needle right at the medial border of the pedicle in AP projection. The reason for that is that anatomically, that's where you expect the junction of the annulus and the nucleus, because we cannot see that, so you have to go by the bony landmark. And the next, we will do the lateral projection. So this picture shows that we are quite a bit posterior where we want to be. My aim when I'm placing the needle is to make sure that as much as I can be in the posterior portion of the disc. Okay, this is the spine wand manufactured by Arthrocare. This is the active tip, and there's a small portion which is insulation. And actually this active portion of the tip is the one which does the ablation.